Okay. Okay, so yesterday we just tested the flexibility, mobility of the ankle, and we tested the stability and flexibility of the hip. Today I'm not going to talk too much, but I'll show you what I do therapy-wise, soft tissue work. Okay, so for the ankle, because you've got muscles that attach onto tendons that end in the foot, it's a good idea before you do work on mobility, you want to loosen up the lines. So here I'm doing soft tissue release, so I move the muscles, the gastroc and the soleus, and I lock, or it's old-fashioned pin and stretch. You pin and you stretch. You lock the energy lines, the fascia, the muscles, the meridians, whatever you want to call it. And you pump. The body works on pumping, the heart, breathing, digestion. You want to move maybe dead cells, restrictions, bring new blood, amino acids, and building blocks. To work this line over here, do it from this side. Here, same thing. I promote movement and I lock just gently. If I'm more comfortable, I can use two knees. I can use my elbow. Go a little bit deeper. And if you want to be active, Elise, can you do that for me, please? Ask them to move and you lock. Very powerful movement. And relax. Okay. From here, I'll move into the ankle joint. And the ankle joint comes at an oblique angle. It's not straight. Okay, so I find the joint which is below the medial and the lateral malleolus, lateral, medial, come over, come under the heel, okay.
At least 7:30 at the restaurant.
And pump. So I'm just springing the joint. Another technique, come over, lock underneath the heel, lock at the top, traction, make space. Come. This is important. Yeah. A lot of ankle restrictions are present because of inversion strains. People go over on their ankle. So what happens? The head of the fibula translates forward. People can't dorsiflex anymore. So what you need to do, you lock to the fib, push down and dorsiflex. So you're pushing the fibula back. Okay. And some nice techniques for the entire foot. Squeezing, rotating, squeeze and release, squeeze and release. Lock, don't be loose with your hands, squeeze. Rotates. Lots of little joints in the foot, and this can realign them. Okay, and very nice to finish with some stretching. Yeah. So you can lock the joint, dorsiflex from different angles. Okay, and you can repeat the process, and this joint should start moving, sliding and gliding. Okay, moving up to the knee. just like the calf, you've got lots of muscles that attach over the knee onto the tibia. Okay, so very nice to release. Push, squeeze, pump. This is just moving energy, isn't it? Yeah? Warming up the fascia, promoting blood flow. The knee itself, lock your fingers underneath, pump. So the secret is this. I'm pumping, trying to make space. Pump. All around the kneecap, the knee joint. You can lock and gap the joint. Some people you need to rotate them internally, external, you need to find where the joint plays the most. Yeah, pretty neutral. If I want to move behind the kneecap, popliteus, muscle that unlocks the knee from full extension into flexion. Okay, and people that have got knee pain, support them. Okay, and very often you will get more movement. Come around the knee, support it. Mobilize the joints. Flexion, extension. Okay. Moving on to the hip. I won't do too many things. You will find lots of people are open. Most of us are open in our hips. Lots of people lack. In this case, she's got great internal rotation. She'll find many folk external, no problem, which means the inside lines are fine, they're flexible. You try and take them into internal rotation and they get stuck. So what needs to be worked? Outside. Okay? Fine, so just some nice gentle techniques. Gentle. Just softening. So I'm moving all around the trochanter. Use my feet gently, walk underneath, keep your heels on the floor always. Lock, place, soften. Very gentle, very supportive. It's not supposed to hurt. And if I want to work the piriformis, lock. Gently place, straight leg. Allow the body to fall back onto your heel. If I'd like to go into the TFL, so just below the pointy bit of the hip, I come down and slightly lateral. Okay. The only reason I do this is to soften the muscle. Always work better on the muscle that's soft, not a stretch muscle. Okay. Gently, place, lock. Body weight. You okay? Place, lock, body weight. Okay. I'll come out of this. We're going to go into the side position now, which is probably the best position to work the anterior part of the hip, or the medial part. Don't make people jump here. It's easy. Yeah? Don't make them do this. Go slowly in. It's like making bread. Yeah? Of course, you can use your heel to go deeper. You can can use your heel, lock, stretch. Use your elbow. Make bread, soften. If you find a trigger point, for sure, open, lock, slowly sink. You'll feel a softening or you'll get a twitch response. Slowly come out. Make people feel good, yeah? Don't hurt them. Let the body relax. If I want to go above the hip into the QL, which I do, I open, place, push. The secret is to push, soften, so a door opens. Place, push, sink, gently. I'm not doing that. Gently, stretch, release. I can work around the iliac crest. Open, place, push, 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 push. Slowly. Open. You only get one chance. If you make someone jump, they don't let you in again. Okay. Go into the belly and the back. We can do a gentle mobilization. Gentle. There's the hip joint, not there. There. Okay. And now we can stretch. So, external rotation, lock, come around, body weight. Release. Piriformis, glute max. Pigeon pose, don't let the foot come back. Sink. Release. Hamstring. Okay. Make space in the joint. Relax. Make space in the joint. Gently stretch, that's enough. If you want to incorporate the energy lines, make space, pull across. Internal rotation, which she doesn't need. It's amazing. Okay, and just a nice stretch to finish it off. Come over, watch this. As soon as the shoulder comes up, lock. Support and stretch. Lower. Lock, support and stretch. Great, thank you. Stay there for a sec.